Welcome to the Lost Vet podcast, where we are helping you to get back to your passion and purpose. I'm your host, Dr. Melodie Chan, and today I am talking with Dr. Alycia Chrenek, who has had extensive experience as an equine veterinarian in practice, as well as a veterinarian for industry and leading teams. Today I asked her what support looks like for her, and I think you'll enjoy the conversation as we dive into what it means to listen, what it means to be supported as a team member, but also as a leader to be supported by your team, and also how important it is to be able to provide clear and kind feedback to each other. Have a listen. Brand new season 2, and I'm excited to welcome Dr. Alycia Chrenek to our podcast. Hello, Alycia.
Hello, thank you for having me.
Always a pleasure to talk to a colleague and one of my good friends, as we love to dive and dissect into all things leadership, management, and just our veterinary profession. I thought today a good topic to sort of press and hammer through is the idea of support. And I guess, Alycia, let's just start with when I say support, what are 2 or 3 words that maybe come to mind for you personally?
I think a big one is listening. The second one that comes up is from what side? So am I looking at it as a manager supporting my team, or am I looking at it as somebody being supported by my manager? And so those are kind of the first things that come up.
Okay. So maybe expand a bit more on listening to you. Like, what does listening mean to you in that context of support?
Right. So you and I've had this conversation a little bit before where some people think out loud and they need just to run through things verbally and have somebody else to bounce an idea off of. Other people, they can internalize it and they think about it themselves and then they come out with a final answer. So whenever I'm trying to be supportive of my team, I'm trying to sort out, are they just talking through this and looking for me to listen and provide a little bit of guidance, or have they made the decision and now they're asking for permission to go on with the next thing? So trying to figure out who I'm talking to. For myself, I'm one of the people who really likes to do a little bit of a mind dump of like, here's my journey of my discussion and this is what I've landed on. And so support to me looks like that, of a dual conversation, having somebody give me feedback, not necessarily the answers, but definitely showing active listening skills and then coming back with the next thing. And I'm sure everybody's seen this before, is there's listening to with the intent of responding, but then there's listening with the intent of actually listening. And maybe it takes a pause afterwards to be like, okay, what do I think about what they just said? And that's okay. I think that's one of the big things that Rob has taught me, is it's okay to take a breath and think about what you want to say, whether you're presenting or in a conversation with somebody.
Yeah. I heard once one of my girlfriends say to me, one question that their therapist had provided to them in couples counseling was, when somebody's coming through with an issue or problem, if the other person's not quite sure what the person's looking for, they can kind of take a moment and just say, are you looking to be heard, helped, or hugged?
Oh, I like that. Yeah, I really like that. Yeah.
Because I think you bring up a good point, right? Like, sometimes I'm actually genuinely wanting someone to give me some advice, like give me some tangible pieces of information. And then, like you said, sometimes it's just, I just need you to listen and just empathize. And sometimes it's just that I need a hug.
Yeah. I think that rings true on so many aspects. So in one of my previous lives, I worked with a nutritional company. And one of the things they said is that customers come to their veterinarian looking for advice. So they actually do want to leave with what is your preferred brand or one or two brands. You don't necessarily have to give them the exact one, um, but they're coming to you, they're asking that question because they want to know. And now that I'm a veterinarian myself, and I still take my own animals to a vet because I do find it challenging to think rationally about my own creatures.
Yeah.
Um, and sometimes that's intimidating for whoever I'm with because they're like, well, why is Alycia doing this? She probably knows the answer. And I'm like, no, I actually want to know what your answer is. Like, I want
Yeah.
to be helped with this. I want your advice. Um, and I think that's really valuable. And then other times I want to talk it through and be like, well, I was thinking this or I was thinking that, and I like that heard, helped, and
Hugged.
hugged. Yeah.
Well, and
Sometimes it's
I
also that.
it is all that, also that you bring up a great point too of just I've been in that situation too, right, where I've brought my pet in to another veterinarian, and you can almost tell that they're on guard, and they're not sure
Hmm.
how to present the info. And I think part of this idea of support, and if you're wanting to be supported, is finding the words of letting them know what you're
Yes.
needing right then. So I've tried in those situations just to diffuse it and say, just 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 speak to me as if I know nothing, because in this space, I'm actually the client. I'm emotional. Like, just please walk me through
Yeah.
it, the way you normally would, and no judgment here. I genuinely need your help.
Yeah. And I think that's one of the things when you mentioned the topic of support that I wrote down is that um, really clear expectations. And so the discussion of clear is kind, that's something I repeat to myself all the time, um, is giving that feedback of what I'm looking for. Now I'm kind of in the manager role thinking of that, is that it's really valuable to my team, to know what I'm expecting, what I'm doing. I'll caveat that with I'm not perfect. I haven't mastered that yet, but it's certainly something that I'm actively trying to do, and that I also request from my managers of, what line do you want me to be on? And for support, I think the big challenge there is if you're looking at developing a team for yourself, is having the right people, because it is super easy for me to support my team right now because they are excellent. They're doing everything, they're taking ownership of it. And so now my role in this part is to make sure they are looking after themselves. They are taking that break, that they are um, really getting balance within their life, and giving them clear expectations because I can trust them to do their role, do their job. Now I
Hmm.
get to look after them, I think is super valuable. So having the right people on the bus makes it much easier to support them in that role and help them to look after them. And I go back to if I look after the people, they'll look after the business. I do think there's challenging spots. So if you have a toxic person on your team, or you have a team that's not functioning and communicating well, that aspect of it can be really hard. And so it always circles back to making sure you have the right people on your team, and that can be a really hard. That's a whole other podcast
Yeah.
discussion.
Yeah.
Um, but certainly supporting them is easy when you've got the right people.
So, sort of philosophical question, I think. Um, do you find that helping to support an individual can sometimes be detrimental to supporting the team? Or do you put the team's support, like, needs first versus catering to an individual? How do you find that balance, and are there any sort of specific examples that come to mind?
Well, it comes back to the Sophie's Choice, right? And so I think it sounds a bit like a cop out, but every situation is different, and it circles back to the clear expectations and
Mm.
realistic expectations of
Hmm.
what can we really expect to achieve in a day, a week, a month. And if our expectations are realistic, then those should all be kind of together, and understanding and empathy that one team member may struggle today and might need a
Yep.
little extra help. Maybe they're sick, maybe, something else is happening in their life, and the rest of the team can help them out, knowing that that's a balance, that it will come to the next person, um, and that those look different to everybody, because not everybody has a kid, not everybody has,
Yeah.
some people actually have an immune system and don't get sick, right? So one day I hope to have one. um, but it's just sharing that load, and as the manager in that position, I do think it's part of my responsibility to look out and make sure that not one person is taking on extra all the time. There will be short periods of time, but hopefully in the long run it's not. And either you have that discussion with yourself or whoever else is in that position to either mentor or advise of, do we need another person if this is happening all the time, or do we
Hmm.
need to change our expectations? Because sometimes that it's not realistic to hire a new person every other day because we think we're busy. Sometimes it's like, okay, we need to change our expectations, and what would that look like? And that comes back into the herd part of it, heard or helped, because that's a discussion, and that's something that I don't like to discuss with me, myself, and I really
Hmm.
like to have somebody that I could actively roll over these ideas with and do the thought experiment.
Yeah. In a clinic setting, what's been your experience, or what have you heard that's been helpful in having this more regular communication touch point with the people on the floor? Because I think one of the biggest challenges you always hear in clinics, again, they're seeing clients, they're seeing patients, they're flat out busy, and I don't have time, or they maybe do this quarterly, so every 3 months,
Hmm.
or at best it's that once a year review, annual review. I mean, that was my experience in practice. Like,
Yeah.
I never got sort of that formal, for I'll say in quotation marks, formal, where you're like, oh, this is the discussion with my boss today,
Right.
once a year,
Yeah.
and so I'm talking 20 years ago when I was sort of in my first practice, and that's how it was done. um what do you see as a best practice, or how people are managing that today in clinics?
Yeah, and I think that really comes down to the culture of the practice. And the culture doesn't happen by accident, it happens on purpose. And it is actually one of the things that is top driven. And another thing that helps, because we're busy on a daily, like
Hmm.
every day, there's
Yeah.
always something. And there is literally animals coming in crisis. And so it's understanding and having that culture of feedback and communication and understanding. Some of these events are extremely stressful. And I realize now, because I've had lots of years to reflect on it, is that as a team, if we have similar language and understanding of where we're coming at these from, I think is extremely valuable. So when you're in surgery and something's starting to bleed, know that sometimes the surgeon or whoever's in charge, uh, they may lash out a little bit and they're like, give me that instrument or do this or do that. At that moment, they're doing their best to get through it. Like having a little bit of empathy for often the person in that role we do have a lot of respect for, because they're the surgeon or they're the veterinarian or they're something, but they're also human. So having that empathy and understanding in the language of the whole team. And then what I would do if I had the chance to go back to practice, I would change now, is that when that moment is done and you're driving out, I was large animals, so driving out, or you're having your coffee, is I would take more of those moments, even if it's like 5 minutes of, thank you for supporting me in there. I got really stressed. It wasn't you, it was the situation,
Yeah.
and just
Yeah.
diffuse that. Or
Yeah.
I was really stressed. I was trying to manage that. In the future, I need this from you. right? So
Yeah.
being really clear about how we can make that situation better, but also taking away that, because as much as I've tried, I would love to not get in that situation and bark at somebody, but inevitably it's still probably going to happen. And so if I have that language and discussion ahead of time to be like, it's not you, it is the
Yeah.
situation. My tone isn't perfect because I got a lot go. I'm trying to manage my breathing and my rate and think at the same time. Um, but here's how you can help me, and here's how I'm going to try to do better. Or even set up that here's like a little code word discussion of like, even if they say like, oh, this is a great time for a breath, or would you like a sponge, maybe that's code for like, settle yourself down, Alycia.
Yeah. Yeah.
Right, like,
Yeah.
um but if we have those discussions ahead of time, then when we get into the moment, everybody can stay a little bit calmer. And even for myself, I could say like, I know this person next to me knows I'm not mad at them, because that is never my intent.
Yeah.
It is really just, we're trying to save this animal, or I'm trying to figure out what's going on, I need a moment to think. um and so that all comes with, on purpose, that psychological safety language in the moment of what's going to happen. And then I really love that follow up idea of just that opening the door of, thanks for your support in there. I apologize for my tone, right? Or whatever.
Yeah.
Maybe it's not even that. Just thanks for your support in there. Let's go to do this next case.
Yeah.
Something there. I've seen in a lot of practices, that we don't feel comfortable with that simple communication, because it's actually pretty simple. um and through my transition into industry, I was like, oh, so how do humans talk to humans? Right, like,
Yeah. Yeah.
so
Yeah.
it's learning that process and really just opening the door for that communication. So
I love that. It's simple. It really is that simple feedback, if you will, and it's feedback in the moment. And I think you and I have learned that lesson throughout our careers in not stalling and
hmm
providing that feedback, whether it's positive or constructive. But
yeah,
especially the positive side, I think you hit the nail on the head there, is maybe as veterinarians and just being these type A personalities, we're always wanting to figure out, what did I do wrong? What do I
yeah,
need to do better? Oh, I screwed up here. Like, this is what's going to be brought up. And maybe that's actually what we carry, because we're never maybe fully focused on celebrating those not even small wins, just kindness, acts of
yeah,
kindness.
exactly, yeah,
And I love that idea of just take that moment just to turn to that person next to you, or call them, when you're leaving the farm, and just say, hey, thank you.
yeah,
I just wanted to, and call people. I would encourage people to call them. You don't need to
yes,
just text them.
yes,
And
yeah,
you also don't always need to ask if it's okay to call. I find that so
yeah,
funny. Do I have permission to call so and
yeah,
so? Um, I love that idea of just provide that feedback in the moment. Um, and I think, again, as a, whether in even colleague to colleague, but even manager to somebody you're managing,
yeah,
again, like sometimes you are afraid to sort of deal with that. Oh, this, I need to kind of provide some guidance here, because I think they could do it better, or
yeah,
and maybe you think, oh, I think they should do it differently.
yes,
And then thinking through that language in your head of like, oh, they should do it this way. But maybe it's approach it as that conversation of, this is what I observed again, and this is what I observed, and this was the outcome. What are your thoughts on that? Do you think we
yeah,
could, what do you think we could do differently next time if the
yeah.
outcome wasn't quite what you both wanted to do?
Yeah, I think that brings up a couple of really good points. Is one is, we shouldn't should on people. So trying to change the language and discussing of, sometimes even walking, so help me understand how this went, because maybe from what I was seeing, this would have been the path I took. So why did we go this way? Or, and every situation is different. Every person is different. And it's okay to start with, my intent here is to understand and so that we can work together better. And I think that works for an employee to a boss or a boss to an employee. It doesn't have to go one way or the other. And being in both roles and having managers with good feedback, I've also come to the real before I thought, well, they're the manager, they know what they're doing, they know everything. I shouldn't question. I'm shitting on myself. But now I realize that no, they actually need that feedback too. Like they haven't necessarily been in this situation before, so they're looking for, even, hey, that was really good. It
Yeah.
means a lot to
Yeah.
your manager in building that relationship of, hey, I think this was a really good way, or that was a really good turnout, or you should be proud of how that worked out. So we can always lead from where we're at. Um, and when you talk about the timing, something that will probably resonate with most of the listeners here, being a veterinary oriented podcast, is that think of this as how you would train a horse or a dog or anything, is in the moment. Like, it does me no good to kick the dog 6 months from now for pooping on the carpet yesterday, right? Like, it really is about right now, what happened, and then you move forward together. And the same is, I wouldn't expect to teach my dog how to sit if I didn't reward it with positive reinforcement, um, at that time. So I'm not saying we're training people, um, but it
But
is the
it's
timing aspect of it. Is if you're not doing it as close to the moment as possible when
mm-hmm,
appropriate, understanding that doing it in front of teammates, embarrassing people
absolutely.
is not the time to do it. Take a moment on the side. And that might be a week later, but try to do it as soon as possible. That is within reason. Um, if sometimes emotions get so high, that is not the time. Sometimes everybody does need a breather to just, settle out. And so it might be that a day or two or whatever appropriate time is there, but
Yeah.
circle back and cover it. So
Yeah, for sure.
yeah.
And it's like you said, it's the way in which you carry it out. Hopefully we're not kicking dogs anywhere, but we're
No, we're not. No, we're not.
or kicking people.
I am not recommending any of that. I'm saying
Oh,
a verbal
yes.
discipline or something. Yes.
Oh, but it's tough because again, like I think I wonder sometimes if our fear of giving giving constructive feedback or trying to correct a situation, for lack of a better term, I wonder if that fear for us comes from how much we as high performers really fear getting in trouble, if you will,
Yeah.
and that seems like such a hierarchical or parent to child type of way of
Yeah.
looking at it. But I think through our just learning experiences and just how it could be where we haven't necessarily always had mentors or teachers that would provide that positive feedback, and all the feedback you're getting is
Yeah.
put the bandage on, like you did the bandage completely wrong, or why
Yeah.
did you suture it this way? And that almost becomes our trauma response, if you will, that we clam up, we just
Yeah.
don't want
Yeah.
to say anything.
Yeah. 100%. And I think one of my favorite quotes is actually Batman from the Dark Knight Rises. Is He says, "Why do we fall, Bruce? It's so that we can get back up." And it's the repair is everything. We are not perfect. And if it's my first time doing a bandage, if it's my 20th time doing the bandage, if it's not the way the doctor wants me to, or it's not correct, I do want to know. I genuinely want to keep getting better. So there's two sides of giving and taking feedback. Is We don't have to say that bandage is horrible. What do you think you're doing? How did you ever get through to this point? It's it's also just that constructive, productive. And also, the bandage is no good actually tells me nothing about what I've done. It really comes back to that clear, okay, is it too high? Is it too low? Is it too tight? Is it too loose? Is it the wrong material? Be very specific, be very clear with
Mm-hmm.
this bandage is too tight. If there's time in the moment, you can explain why too tight would cut off the circulation or whatever you're worried about. Because that also gives that person your guidance to how to improve. Um, and then on the other side is to say, oh, thank you for the feedback. How do I do this better? Or what would you like to see? Or, whatever it is that, again, simple communication, basic, clear is kind of what, because like I said, the bandage is no good. Okay. Like what does that even mean, right?
Yeah.
So
Yeah.
really coming down to that, and with the intent of getting better. And this comes back to when you have the right people on your team, you're not anxious about giving somebody feedback because you know it will be received with the intent that you're giving it. Also, you can take feedback from somebody when you have that clear communication because I trust them. And if I'm in that role where maybe that lots of times there's technicians there that have been in practice for 20 years longer and I've been a vet for 12 months. I
Mm-hmm.
do want to know, I want to hear from them what their thoughts are on that bandage because they've seen so many things.
Yeah.
And that trust and communication goes both ways. Um, that when you have the right people, now you can really communicate with trust and understand that we're both coming just to get to the right spot.
Well, this has been an amazing conversation, as I knew it would be. So thank you for your time.
You're very welcome. Thank you. I enjoy it.
I started off this conversation asking Alycia what she thought support was for her and what it looked like. And I think where we landed on is thinking about support through feedback. And so looking at it from two sides when we think about support, are you a person who is a team member that is needing support, or a leader who is also looking to support others or be supported yourself? And I think one of the key things we landed on was being able to verbalize what support looks like for you and letting the other person or other people know what that means. And again, remembering that can change day to day, that can change month to month. So being open and having that culture of communication within the team of what support looks like, which actually reminded me of our discussion about having a team charter where it's the fundamental basic question of answering what is it reasonable to expect of each other. And that can really help frame and shape your culture in thinking about what supporting each other looks like. I brought up a helpful idea of clarifying by asking the other person, are you looking to be heard, helped, or hugged today? And while it may seem like a funny question, it may help you frame your discussion and what you need. So, having that idea of clearly communicating, clear is kind, and providing both positive feedback to people. Remember that we don't need to always just be looking at what has gone wrong or where things could be improved, but really just taking that 5 minutes, maybe it's even just 2 minutes. Call your colleagues, call your friends, call your manager, and just say thank you in that moment after something's happened that you've gone through together. Thank them for the little things. It doesn't take a lot of time, and it can actually mean a bunch and heaps to help them as they keep going in their journey. So thanks for listening. Until next time.